If you've ever seen an ad for a carotid Doppler ultrasound screening or a stroke cardiovascular screening or something like that, and it's at a local church, a community center, and sometimes even a hospital, then they're probably doing a carotid artery Doppler flow screening, not a CIMT. They both use an ultrasound probe on the neck, so they look like the same thing, but they're completely different. In the CIMT live demo video, we used Doppler flow several times. It helped us navigate the arteries and look for anomalies. This is the artery, and this large colored area is where the blood is flowing. Doppler flow measures the peak systolic velocity of the blood flow. It's usually identified as PS or PSV. That's the same systolic from your blood pressure reading. The big number on top is the systolic reading, when your heart is pumping blood out, and the diastolic is when the heart is resting. If the peak systolic velocity is high, it infers a narrowing of the artery. It's a lot like your garden hose. If you partially block it, the water velocity increases and jets out. If you open it back up, the water flows easily. So an increase in blood flow velocity implies a narrowing or a blockage of the arteries. The cutoffs used by the Society of Radiologists in Ultrasound are PSV below 125 is, quote, normal. They even go so far as to say no plaque or arterial thickening, which I think is absurd. Of course you can have plaque below 50% blockage. When the peak systolic velocity hits 125, then you may have up to a 50% blockage. 125 to 230, 50 to 69% blockage, and over 230, more than a 70% blockage. And it goes without saying that if you have no flow, then you are 100% blocked. But I think you're going to know that long before you get a Doppler flow screening. So a Doppler flow screening doesn't really give you any indication until your artery is 50% blocked, and it doesn't tell you the type of plaque. That doesn't sound real useful to me. You've probably seen a lot of graphics like this one that show the progression of plaque buildup in the artery. And while this implies that the plaque has to be quite large to rupture out into the bloodstream, where it coagulates the blood, which causes a clot, which deprives any downstream organs of oxygen, which kills that tissue, know that even small plaques can rupture and cause the exact same problems. If the tissue killed is the heart, you have a heart attack. If it's the brain, you have a stroke. And it doesn't matter if the clot came from a large or a small plaque. Both are just as deadly. And this really only pertains mostly to soft plaque. Once this gooey plaque has had a chance to solidify or calcify, the risk of rupture and clotting goes way down, and this stuff never happens. Which is why calcium scores aren't a good predictor of risk either. Do you really care how much hard or calcified plaque you have? No. You want to know how much soft plaque you have to predict risk, because that's what ruptures and initiates the cascade that causes the damage. There's a link to the calcium score video in the description below. So the fact that Doppler flow studies only recognize plaques that block the artery by more than 50%, and they don't tell you if it's soft or hard plaque, does not impress me at all. It's a very crude measurement and not a great predictor of cardiovascular risk. By the way, have you ever heard of a stress test? That's a test where they put you on a treadmill or inject drugs to increase the stress on your heart while they look for anomalies. Those typically only detect plaques that block the artery by 70% or more. Learn more about that in the stress test video, which is included in the description below. Compare that to a CIMT, where you can actually see and measure the thickness of the artery wall down to fractions of a millimeter, regardless of size. You don't have to wait for the artery to have a 50 or 70% blockage, which means you can identify your risk years or even decades before a Doppler flow or a stress test will see anything. Again, Doppler flow studies don't tell you what kind of plaque you have and don't measure the thickness of the artery wall. They just measure the velocity of the blood, which implies a narrowing of the artery of more than 50%. For example, here's a Lifeline screening I found online. They're one of the bigger players in the Doppler flow screening market. And you can see they're measuring the peak systolic velocity of the blood flow of the left and right carotid arteries. Looks like they subdivided the cutoff we saw a minute ago. Remember, the first cutoff was at a PSV of 125, which corresponds to a 50% blockage. That would be here on this graphic. Looks like they broke that lower range up into normal and mild, but it's still a crude measurement. That's odd. If a PSV that runs all the way from 11 to 125 represents mild, then shouldn't that mild region extend closer down to 11? Well, whatever, that's not important. What is important is, do you see any artery thickness measurements down to a fraction of a millimeter? No. Can you see the type of plaque? No. Here's another one called an AngioScreen report. The upper section is other stuff, so let's zoom in on the bottom half. Fancier looking, but again, they're just measuring the peak systolic velocity of the left carotid, the right carotid, and they show a sample of normal blood flow. And look, there's that magic 125 cutoff again that represents a 50% blockage. This image shows what a restricted blood flow might look like. Going back to the ads, how do you know if a company is doing a real CIMT or a Doppler flow? Well, sometimes it says, but most of the time it doesn't. If it doesn't say, then just go to their website and look. For example, Lifeline Screening doesn't state it in their ad, so we'll look at the Lifeline Screening website and work our way down the menus to carotid artery disease and scroll down a bit where you see they tell you this is a color flow ultrasound that measures blood flow. They don't say it's a CIMT that measures the thickness of your artery walls or shows you the type of plaque you have. Now, I personally have an issue with them telling you to reduce saturated fat and sodium. That's not correct at all, especially for folks pursuing a heart and lifestyle healthy, ancestrally appropriate, low-carb diet. And it really bothers me that they push you directly to surgery to remove the plaque or getting a stent without knowing the true extent of the plaque or how stable the plaque is. I think you're much better off getting a CIMT that does tell you how stable the plaque in the carotid artery is, or get a coronary CT angiogram that gives you a clear view of the amount and type of plaque in your heart's arteries. There's a link to the CT angiogram video in the description below. In my opinion, since CIMTs cost about the same as a Doppler flow screening, and they give me a much better assessment of arterial risk, there's really no reason to even consider a Doppler flow screening. Now, to be fair, I should point out that the cost of most of these Doppler flow screening tests tend to include 3 other tests for that price. They test for atrial fibrillation, which you probably already get at your annual checkup, peripheral artery disease, which is just taking your blood pressure at your arm and on your ankle and comparing the two. They should be similar. And they use ultrasound to look at the size of the abdominal aortic artery. It's the main blood superhighway from your heart to your abdomen. The ultrasound is looking for enlargement. Now, that's usually covered by insurance, especially if you're at risk, so just get your doctor to order it. So in the overall scheme of things, these guys are kind of minor. Bottom line, if you're getting an ultrasound of the carotid artery in your neck, be sure to ask if it's a Doppler flow screening or a CIMT. Or just ask if it measures the carotid artery wall thickness or the type of plaque. One final note, I am not a doctor and I don't have any medical training, so please don't take any of this as medical advice. I'm just using this YouTube platform to help me learn about this stuff because there's no better way to learn something than to try and explain it to someone else. So leave a comment below and tell us your thoughts. It'll help everybody learn. There's a whole playlist of videos all about CIMTs, and it even includes a live demo or two so you can see for yourself exactly how it works. See the links in the description below.